नमः पार्वती पतये गोविंद नाम संकीर्तनम्।
रागादि रोगान सततानुषक्तान अशेषकाय प्रसृतान शेषान औत्सुक्य मोहार अतिदान जघान यो पूर्व वैद्याय नमोस्तु तस्मै. I thank the Dharmambulam team for giving me this opportunity to talk about Ayurveda. I am Dr. Gokulakrishna Aiyar, a practicing Ayurvedic physician in Srirangam in Tamil Nadu. I did my undergraduate in Ayurveda in Sri Jayendra Saraswati Ayurveda College, Chennai. So today, I would like to discuss about what Ayurveda is. So we've got many different Shastras. Our Vedic Rishis and Acharyas have given us many different Shastras. So we've got Yoga Shastram, we have got Tarka Shastram, Purva Mimamsa, Vedantam, Vyakaranam, Dharma Shastram we have got. So we have got Bharatanatyam as a Shastram. And many different knowledge systems have been given to us by our ancient Vedic sages and Acharyas. And Ayurveda is one among these sacred knowledge systems. And this is the traditional and natural healing system of India. Ayurveda is the science and practice that is of Indian origin. It deals with caring for a patient, making diagnosis, making prognosis of diseases, preventing and treating diseases, and offering palliative care, and even surgery to patients who have undergone trauma or injury or suffering from diseases in which the anatomy of any part of the body has got damaged. Yes, of course, today in the 20th and 21st century, no more we practice major surgeries. But in the past, Ayurvedic Vaidyas had been practicing surgery. So apart from this, so this is the general view of Ayurveda today. But the word Ayurveda means, the Ayuhu means life, Veda means to know. So a science that concerns with the study of any life form is Ayurveda. So basically in Ayurveda, so we look at health, the state of health and diseased state through the eyes of three doshas named as Vata, Pitta and Kapha. And then 7 dhatus or 7 systems of body tissues. And then 3 malas. And then there is a concept known as Agni. So Agni or Jathara Agni. So this is the central digestive fire which all, not just all human beings, all living entities have. So this is, so as far as animals are done, animal kingdom is concerned, the central digestive fire that is there in our gastrointestinal tract, that is known as Agni. So Ayurveda explains health and disease in the language of the 3 doshas, the 7 dhatus, the 3 malas, and the Jathara. So there is a very famous shloka in classical Ayurvedic treatise known as Sushruta Samhita. So we've got many Ayurvedic texts. So just like texts like Bhagavad Gita, the Upanishads, and Brahma Sutras are very important in Vedanta. There are ancient treatises in Ayurveda written by ancient sages, and some were written by acharyas in the medieval ages. So one such ancient treatise in Ayurveda is known as Sushruta Samhita. We have got Charaka Samhita, Bhela Samhita, Harita Samhita, Ashtanga Hridayam composed by Vagbhatacharya. All of these are ancient treatises that were written more than 5,000 years ago. So in Sushruta Samhita, so this Sushruta Maharshi was a direct disciple of Bhagavan Dhanvantari himself. So we all know, so in our Itihasa Puranas, we all know that Lord Vishnu appeared himself as Dhanvantari. So during the process of Samudra Mathanam, so from the ocean, Bhagavan Dhanvantari appeared himself. Apart from this, Lord Vishnu, there was another Dhanvantari Bhagavan. This Dhanvantari was the son of a king of Kashi, and he was known as Divodasa Dhanvantari. And the Sushrita Maharshi, who compiled Sushrita Samhita, was a disciple of Bhagavan Dhanvantari himself, and all that he acquired from his guru Bhagavan Dhanvantari, he compiled it in the form of Sushrita Samhita. So just like we've got all ancient treatises like Bhagavad Gita, so it is a samvada between Lord Krishna and Arjuna. In the same way, Sushrita Samhita is a conversation between Sushrita Maharshi and his guru. So here in Sushrita Samhita, the Acharya gives definition of the healthy individual. Who is a healthy individual? The Acharya says, Samadosha Samagnischa Samadhatumala Kriyaha Prasannatmendriya Manaha Swastha Ityabhidhiyate. So the word Samadosha means a person in whose system, in whose body system, the three doshas, Vata, Pitta, Kapha, are in equilibrium, so they are in balance. Samagni, the word Agni means the central digestive fire that I told you. And apart from this central digestive fire known as Jatharagni, this Agni has 5 manifestations of itself within the gastrointestinal tract. And these are known as the 5 Bhutagnis. So we all know that the entire world is made up of the 5 elements: Prithvi, Jala, Agni, Vayu, and Akasha. So these are known as 5 Mahabhutas. The entire world is made up of these 5 Mahabhutas in innumerable permutations and combinations. So in the same way, even the food that we eat, all forms of food that we eat, so they are composed of all these 5 elements known as Mahabhutas. So to digest each component of Mahabhuta within the food, we have got each Agni. For example, Prithvi Bhuta Agni digests the Prithvi component of the food. Jala Bhuta Agni digests the Jalam component of the food. So in this way, we have 5 Bhuta Agnis, and in the 7 systems of body tissues that I told you, we have got each Agni that is known as Dhatu Agni. And the 7 systems of Dhatus are, so we say Rasadhatu. So the food that we eat, so once it undergoes transformation, it gets converted into a colorless fluid that is known as Rasadhatu. And when the Rasadhatu undergoes transformation by its own Agni, the Agni which causes its metabolism, it gets transformed into the second Dhatu known as Rakta Dhatu. Rakta Dhatu undergoes transformation and forms Mamsa Dhatu. So the muscles could be correlated with Mamsa Dhatu. And after Mamsa Dhatu, there is another Dhatu named Medo Dhatu, which is the adipose tissue, and all forms of fat, cholesterol, everything that is there in the body could be correlated with the 4th or Medo Dhatu. The 5th one is Asthi Dhatu, or the skeletal system. The 6th one is Majja Dhatu, the bone marrow and the brain. And the 7th one is Shukram, or the reproductive Dhatu in both the male and female. In this way, we have got 7 Dhatus within our body. So he says Samadhatu Malakriyaha. So the 7 Dhatus, and then the 3 Malas are metabolic waste. So these are the urine, feces, and sweat. So these are Malas. So the word Kriya means normal functioning. So a person in whom the functioning of the 7 Dhatus and 3 Malas are in balance. So he is known as a Samadhatu Malakriyaha. And then Prasannatmendriya Manaha. So a person whose Atma, that is the Jivatma, and then the Indriyas are the 5 sensory organs, and then Manas, that's the mind. So when all of these are in tranquil, a person is known as Prasannatmendriya Manaha. The word Prasanna means tranquility. So it is such a person who is considered as Svastha, or a healthy individual. So what is Vata, what is Pitta, and what is Kapha? So these are the basic functional entities of the body. So all of us have got these three entities, Vata, Pitta, Kapha, right from the head to toe. So every cell, every tissue, every organ, and every system within the body. So it has got each of these doshas named as Vata, Pitta, Kapha. Not just we human beings, all animals, amphibians, reptiles, plants, and even the bacteria and viruses. So even they have got these three doshas, Vata, Pitta, Kapha. So all living entities have these three basic functional entities, and all the basic physiological processes of all life forms are governed by the three doshas, Vata, Pitta, Kapha. And all of these terms are, they cannot be translated into English or any other language. So we call these as Sanskrit non-translatables. So in all of our Indian Shastras, there are many technical terms that are unique only to that particular Shastra. For example, Vedanta Shastra, so it has got certain terms that are unique only to it, and they can never be translated into English. The same way, Purva Mimamsa, Yoga. So every Shastra has its own technical terms that can never be translated into other languages. So just like how in modern science, whether medicine or any physics or chemistry, so there are many terms that are there in English. We cannot translate them into our regional languages. So many, so if, we might hear many people trying to translate modern scientific terms into Tamil or other regional languages. It doesn't sound good. In the same way, these terms Vata, Pitta, Kapha, Agni, so these are Sanskrit not translatables. And Vata cannot be, so Vata is not the physical air that we breathe in. Pitta is not bile. Kapha is not mucus and phlegm that we spit out, that mucus or phlegm that gets accumulated as a metabolic waste within our lungs. So yaro mute pananume, yaro othar. அத்தனை பேரும் மியூட்ல இருந்தா கொஞ்சம் ஈஸியா இருக்கும் எனக்கு. So as I told you that the five Mahabhutas make up the world. So in the same way, the Akasha Mahabhuta and Vayu Mahabhuta. So these two combine to form Vata dosha within the body. And in the same way, we have got Pitta dosha. So Agni and Jala Mahabhuta together form Pitta dosha within the body. And in the same way, Prithvi Mahabhuta and Jala Mahabhuta combine to form Kapha dosha within the body. So, and in the same way, many different permutations and combinations, the two Mahabhutas, Vayu and Akasha, combine to form 5 different Vatas within the body. Agni and Jala Mahabhuta together combine in many different permutations and combinations to form 5 different Pittas within the body. Prithvi and Jala Mahabhutas combine in many different permutations and combinations to form 5 types of Kaphas within the body. So even while doing Parishechanam, the mantra, we say Pranaya Swaha, Apana Swaha, Vyana Swaha, Udana Swaha, Samana Swaha, Brahmana Swaha, we say. And then we, after saying each mantra, we put the morsel of rice into our mouth. Yaro tar mute podanume. Okay. So for instance, so I was telling you that there are 5 types of vatas within the body. So prana, apana, vyana, udana, samana. So pranavayu is the entity that is there in all the sensory organs, all the 5 special senses, the 5 senses that we have: the ear, the skin, the eyes, the nostrils, and the tongue. So these are known as 5 indriyas, 5 jnana indriyas. So it is pranavayu that is there in each of these indriyas, and every sensory input that we get. So for example, if we have a visual presentation in front of us, so the moment when you keep our eyes closed and the moment we open our eyes, so within fraction of a second we are able to perceive everything that is there in front of us. So the moment we hear a sound, so it could be our some human being around us, when he or she speaks, Now, within fraction of a second, we are able to hear him or her. When something is placed on our skin, so anything hot or anything ice cold is placed on our skin, any part, any surface area of the skin, we are able to perceive it immediately. So all of this is because of pranavayu that is situated in each of our indriyas. So it is pranavayu that carries the sensory information from our indriya. Within fraction of a second, it takes it converts the sensory input into nervous impulse, and then takes it to the manas, and from manas it takes to the brain. In this way, it helps in processing the information that we perceive. Apart from this, we have got Udana Vata. Udana Vata is responsible for energy levels. Sometimes we'll be, very, energy, we may be able to do a lot of work. Sometimes when we are extremely tired, it means that our Udana Vata has decreased. And there are certain children, they suffer from disease known as attention deficit hyperactivity disorder. They'll be extremely active. They won't stand or sit in a place for for any time. They keep running here and there. The moment they come to a doctor's clinic, immediately they'll come rushing to the doctor, pulling or pushing him. So then, in such children, Udana Vata has undergone abnormal increase. And then Udana Vata is responsible for voice production. Apart from this, we have got Vyana Vata. So Vyana Vata is responsible for every circulation that is there within the body. The circulation of blood is possible because of Vyana Vata. And in the same way, every gross motor function and fine motor functions that we do, we are able to lift our hand, we are able to rotate our arm, we are able to rotate our neck. So every movement that is possible in each of our joint, so that is because of proper functioning of Vyana Vata. And Samana Vata is responsible for the proper digestion. So this Samana Vata is the entity that assists our digestive fire known as Jatharagni. And then the Apana Vayu, so this is the Vayu that is responsible for eliminating all the metabolic waste. So the process of urination, so that is because of normal Apana, the normal movement of Apana Vata. And then, the process of defecation is because of Apana Vata. So when the Apana Vata within the urinary tract, so when its movement gets obstructed, so we call this as Anuloma Gati. The word Anuloma in Sanskrit means from above downwards. That is Anuloma. Pratiloma means from below up. From below upwards is Pratiloma Gati. Anuloma is from above downwards. So the Anuloma, so that is the normal movement of Apana Vata. So within the urinary tract, when its normal movement is obstructed, it results in a lot of urinary tract diseases. For example, when kidney failure, this Apana Vata involvement is there. And then in the lower part of our intestines, when the movement of Apana Vayu gets obstructed, we get constipation. So from simple constipation to serious medical emergencies like intestinal obstruction. So it is the Apana Vayu that is responsible for all this. And then, the normal ejaculation of semen in men is that depends on Apana Vata. And in women, the monthly menstrual flow is because of healthy Apana Vata. When there is abnormal increase in Apana Vata into the female reproductive tract, it may lead to profuse bleeding, diseases like heavy menstrual bleeding occurs. When Apana Vayu, the movement of the Anuloma Gati of Apana Vayu gets increased abnormally. And when the Apana, this Gati of Apana Vayu gets impeded in the female reproductive tract, it results in conditions like polycystic ovarian disease. Even after 4 or 5 months, a woman may not get her periods. So that is because of improper functioning of Apana Vayu. And in the same way, during pregnancy, it is Apana Vayu that is also responsible for keeping the Garbha involved. And then normal delivery or any brief presentation, all this depends on the proper functioning of apana vayu. So any normal delivery happens when the apana vayu within the female reproductive tract functions normally. So any complications in pregnancies is also a result of apana vayu, apart from many other factors. So in the same way, we've got 5 types of pitta, we've got 5 types of kapha. All of these perform many different functions within the body. And then we've got so there is a concept known as 20 gunas in Ayurveda. So it is through this concept that we look at every disease, every condition, whether a healthy condition or a disease condition. So for instance, or the 3 doshas named vata, pitta and kapha. So each of them, they undergo increase or decrease in these gunas. So the word guna means quality. So the 20 gunas are guru and laghu. So guru is anything that is heavy to digest, we call it as guru. And anything that is lighter to, for the digestive fire to digest is laghu. And then mandam is slow, tikshnam is sharp, or anything that is alkaline is mandam, anything that is acidic is tikshnam. And then shitam and ushnam. The word shita means anything that is cold, ruksham is anything that is hot. And then we have snigdham and ruksham. So the word snigdham is anything that is viscous. For example, ghee and oils that we take. So these are snigdham in nature. So they are viscous in nature. And dry powders that we may eat, so they are dry in nature, ruksham in nature. And then shlakshnam and khara. The word shlakshnam means anything that is slimy, and khara is anything that is rough. And then sandram and drava. The word sandram means dense, drava means liquid. And then mridu and kathina, soft and hard. And then sthira and chala. The word sthira means anything that has got no movement. Chala is anything, chalam or saram means anything that has got mobility. Sukshmam is subtle and sthulam is gross. Anything that is microscopic is sthulam. Anything that is gross is sthulam. Sukshmam is anything that is microscopic. And vishadam and pichalam means clear and sticky. So it is through these 20 gunas that we assess the quality of each of the doshas, vata, pitta, kapha. And then we've got 5 pittas. For example, pacha. So there is pittam known as pachaka pittam. So that is responsible for proper digestion. And any indigestion is when this pittam decreases. So any indigestion occurs. And there is another pittam known as ranjaka pittam. So what ranjaka means to impart color. So I told you that the very first dhatu or system of body tissue that forms in the body is rasa dhatu. This is a colorless fluid. So this rasa dhatu undergoes transformation when it gets combined with ranjaka pittam, and it is this ranjaka pittam that imparts red color to the rasa dhatu, colorless rasa dhatu, and makes it red. It makes it red in color, and then we have rakta dhatu or the blood. And then we have got sadhaka pittam. So this sadhaka pittam is the pittam that is there within the brain. So the normal functioning of the brain. So we have got many different areas in the brain that control many different functions of the body. So all of this is because of proper functioning of sadhaka pittam. And alochaka pittam is the pittam that is situated within the retina of our eyes. We are able to differentiate colors, many different objects in many different colors we are able to differentiate. It is because of the proper functioning of this pittam known as alochaka pittam. And we see, some people who have color blindness, they may not be able to differentiate between colors. So when this, when there is some derangement in this alochaka pittam, a person gets color blindness. And apart from this, we are able to the way we see in bright light and in dim light. There is a difference in the way we see in a bright light and the way we see in dim light. All of this is controlled by alochaka pittam. And then we have got something known as bhrajaka pittam on the surface of our skin. It is this bhrajaka pittam that is responsible for the complex color and complexion of all human beings and animals. And anything that we apply, so any oil or anything that is applied externally, so the virium or potency of that is taken by the Bhajaka Pittam into our system. And then we have got 5 types of kapha. So the first one is known as Avalambaka kapha. So that is the so it is this kapha that is responsible for the proper functioning of all other kaphas in the body. And then we've got something known as Kledaka kapha, which we have in our gastrointestinal tract, within our stomach lining. For example, the pH of our gastric juices is extremely high. So if we were to extract the hydrochloric acid that is there within our stomach and directly pour it into our hand, it will corrode our hand. In the same way, if we extract the hydrochloric acid from our stomach and pour it directly onto a metal, the metal will get corroded. So how is it that our stomach has the ability to withstand and remain remain unharmed by this acidic acid? So this acid, that is hydrochloric acid, could be roughly correlated with our Pachaka Pittam. And so it is Kledaka kapha. So there is a mucous membrane. So there is a mucous membrane within our stomach, which prevents the stomach wall against the acidic nature of the HCl. So that is we call that as Kledaka kapha in Ayurveda. So when there is any reduction in this Kledaka kapha, people experience acid peptic disorders. People may experience gastric ulcers, and then there is something known as gastroesophageal reflux disease. So this is known as GERD. So normally this is a normal physiological function. So there is a valve at the end of our esophagus. So anything that we eat, small quantities of the food that we eat, once it enters into the stomach, it gets it starts undergoing digestion. So a small amount of it may come back to the esophagus, and then it goes back into the stomach. This is a normal physiological process, and in very small quantities when it occurs, it is a normal thing, and it's not a harmful thing. Now, when excess quantities of the food starts coming back to the esophagus, so once it enters into the stomach, it becomes highly acidic. So it is not the same as it enters from the mouth. So what happens is food that comes in large quantities from the stomach. So when the sphincter that is there between the esophagus and the stomach, when it becomes weaker, so large quantities of food will start flowing back into the esophagus, and that results in a disease. So this is known as gastric esophageal reflux disease. And then duodenal ulcers, ulcerative colitis, Crohn's disease, in all these disease conditions. So as per Ayurveda, we say that there is a reduction in Kledaka kapha and abnormal increase in Pitta. And then we have got Bodhaka kapha that is there in our tongue. So all the different kinds of taste that we perceive. So it is it is a result of Bodhaka kapha that is there within our taste buds. Bodhaka kapha and Pranavata within the tongue. And then there is something known as Tarpaka kapha within the brain. So it is this kapha that nourishes the entire brain. And then it is this kapha, by nourishing the brain, it also nourishes all the special senses. The eyes, the ears, the nostrils, and the mouth. So it is this Tarpaka kapha. For example, the structural basis of there is a nerve known as optic nerve. So it is this nerve that is responsible for vision. And then there is some nerve called acoustic nerve that is responsible for hearing. And we have got each nerve in each of our senses. So the structural basis of each of these nerves and proper nutrient supply supply to all of these is taken care of by Tarpaka kapha. And the fifth type of kapha is known as Shleshaka kapha. And this is situated in all of our joints. So we've got two bones, between one bone and the other bone. So when they join, there is some surface they don't collide with each other. So there is some fluid within every, between two bones, that acts as a lubricant, between them. And that is known as Shlesha Kapha. In modern sense, it is known as synovial fluid. And when there is a decrease in this synovial fluid, person starts developing diseases like osteoarthritis. So commonly it is the knee joint which commonly gets affected. So when the synovial fluid within the knee, so when that gets reduced, so it is a decrease in Shlesha Kapha and an increase in Vata, and a person experiences pain in the knee. So this is about the 5 types of Vatas, 5 types of Pittas, and 5 types of Kapha. And then we have the concept of Jatharagni, which I explained. And then we have got the 7 dhatus or systems of body tissues. So this is about it. So it's already 8:30 now. So I would like to explain certain things in just a short span of time. Apart from these things, there are a lot of interesting concepts that have been described in Ayurveda. So so today we have technology. Technology has advanced in many different ways. So we've got MRI, we've got X-ray. So all of this has become a very common thing today. And then many diagnostic procedures, many complex diagnostic procedures as a result of advancement in technology is possible today. But 5,000 years ago, when all of these instruments were not there, when all of this technology was not there, our ancient rishis and acharyas had knowledge about very minute things that take place within the body. When we look at the description of anatomy, in our classical Ayurvedic texts, we'll be surprised. For example, the science of embryology has been described in great detail by our acharyas. And then the science of ophthalmology. So when we go through eye diseases, in Ayurveda, we'll be so surprised as to how they have explained a lot of things which are not possible to diagnose, without having a lot of diagnostic tools and machines. So while describing the anatomy of eye, both Sushruta and Vagbhatacharyas, they have explained. So he begins to say, Vartmasandhim sitam krishnam drishtim va sarvamakshiva rogan kuryuhu. So this is how he begins to tell the anatomy. So the word Vartman means, the literal word of Vartman means skin. So here the eyelids refer to Vartma. So we have got something known as the Vartma Mandalam within the eye, the external eyelids. There's something known as Sandhi Mandalam. Sandhi is the junction, junction between the eyelids and the white portion, between the white portion and the black portion, between the black portion and the aperture known as pupil. So the word Sitam is the sclera. Say this is known as Shukla Mandalam or Sita Mandalam. The word Krishna Mandalam is the cornea, iris, and all of these belong to the Krishna Mandalam. Drishti Mandalam is the pupil, or this is the aperture through which light enters into the eye. So this is how both Sushruta and Vagbhatacharya, they explain the eye diseases in great detail. Apart from this, our ancient acharyas, they've made great contributions, in the field, the field of ophthalmology, in the field of many different sciences. For example, in gastrointestinal diseases, so there is something known as Uttara Roga. So the word Uttara literally means stomach. So when we say Uttara Roga, many groups of gastrointestinal diseases, so they could be grouped under Uttara Roga described in our classical Ayurvedic text. So there is one group of Uttara Rogas named as Chidrodaram. The word Chidra means any hole or any perforation. So now there are conditions like intestinal perforation and all that. So these are medical emergencies which require surgery. So for when Chidrodaram occurs, so when there is any break in the continuity of the the lumen of the intestine, so it gets torn apart. When there is a tear in any part of the intestine, it is known as Chidrodaram. So in such conditions, our acharyas have explained, surgical procedures in great detail. And if we, study the ancient Ayurvedic texts carefully, and when we, analyze, compare that with the modern surgeries that is being performed by, modern gastroenterologists, we will know that the same principles have been followed in ancient times also. Although the practice may be different, the procedures they do may be different, but the principles behind the procedures will be the same. So we've got anesthesia today, and we've got many technologies in surgery today in modern operation theater. So all that was not there 5,000 years ago. But the principles which our rishis and acharyas have told, so that remain the same even today with change in technology. So in the same way, in the field of ophthalmology, in Tanjavur, there is a famous library known as Saraswati Mahal Library. And this library has many rare manuscripts in many different fields, in many different languages, in Sanskrit, Tamil, Malayalam, Kannada, Marathi, Telugu, and many different languages in many different fields. And I know recently, some 15 years ago, a team of researchers, they came across a rare manuscript that was composed by Sarabhoji Maharaja of Tanjavur, the Maratha king who ruled Tanjavur. So the Maratha kings who ruled Tanjavur, they've made many great contributions to our society, to the land of Tamil Nadu. And among the many different contributions they have made, in the field of medicine, they've made huge contributions. So the Maharaja, so he had a very big herbal garden in the palace, associated with the palace. He had innumerable Vaidyas, Ayurvedic Vaidyas, Siddha Vaidyas, Unani Vaidyas, and he also had modern allopathic doctors from the Britishers. So they all used to work together. So whenever required Ayurvedic treatment used to be given, when required Unani, when required Siddha, so wherever required modern allopathic medicine, so some 150 years ago that used to be there. 150 and 180 years ago, that is how the society was functioning. So in the same way, Sarabhoji Maharaja, he wrote a book which had many diagrams of many clinical diseases. So many clinical photographs could be seen in those manuscripts. So this is just an example of it. So this is a case of Shuddha Shuklakam. In modern medicine, this is known as corneal glaucoma. And then this is a case of Kshataja Shuklam. This is corneal ulcer. So the cornea is the black portion of the eye that we see externally. So when there is any ulceration in the cornea, so that is known as Kshataja Shuklam. And then this is a case of vernal keratoconjunctivitis. And then this is a case of Arman or pterygium. So this is a case. So the word Arman, Armaroga in Ayurveda means, so there is no small ankuram of mamsa. So that starts growing within the eye, and it may start developing from the sclera. And when it starts growing, eventually it may even invade the cornea. So in such a condition, it is surgery that is required. And even for this disease, our acharyas, both Sushritacharya and Bhagbhatacharya, they have explained a detailed surgical procedure. When we go through this surgical procedure, and the surgical procedure, the modern surgery that is being done by ophthalmologists for the disease of pterygium, so the principles will be the same. So once again in Sushrita Samhita, Acharya classifies the eye diseases into 8 based on which surgical procedure has to be done. So there are two classes of eye diseases broadly. Diseases that require medicine. So those are bheshja sadhya. Bheshajam means medicine. Sadhyam is anything that gets cured with bheshajam is bheshja sadhyam. So these diseases get cured with medicines. There are some diseases that are shastra sadhya. Shastra means surgical procedure. Sadhyam is anything that gets cured with it is sadhya. So for some diseases, surgery is mandatory. So there are 8 groups of diseases which require 8 different surgical kind of procedures. Chedya rogas, Bhedya rogas, Asia rogas, Lekhya rogas, and so on. So he describes 8 kind of surgical procedures, and many different diseases require many different kinds of chedanams, many different kinds of lekhanams, many different kinds of ashanams, and so on. And then this is a disease named as kukunakam, which occurs in infants. This is known as ophthalmia neonatorum. Excess pus discharge occurs from the eyes. And then this is a condition known as ptosis. We call this as vatahata vartman in Ayurveda. So the eyelid starts sagging. One eyelid remains normal, and the other eyelid starts sagging abnormally. It comes down, and the person's eye remain abnormally closed. And even for this disease, our acharyas have explained surgical procedure in great detail. So this is about the scientific wisdom that is there in our classical Ayurvedic Shastra. Apart from this, so there are certain advice that we have as Ayurvedic physicians, some basic advice to have a healthy lifestyle. So what you can do is, getting up early in the morning is extremely good for health. And that keeps your circadian rhythm in normal. The health of circadian rhythm, the normal sleep-wake cycle, and many different cycles, biological cycles, clocks within the body. So all of that, will function normally, when we wake up at Brahma Muhurtam. So this is the early morning time after between 4:30 and 5:30 is known as Brahma Muhurtam. Waking up at that time is extremely good for health because, going to bed at, early in the night is very good for health. So only then, the entire biological clock within our body, so the whole of our circadian rhythm remains healthy. And then, you'll have to consider your digestive system. Eat what is good for you. And then every day, before on waking up, offer prayers to Bhumi Mata, and then empty your bladder and bowels, and then brush your teeth, clean your tongue, and do Gandushanam every day, or if not if every day is not possible, at least for 2 to 3 days a week. So Gandushanam is the practice in Ayurveda in which there are certain oils which have to be mixed with hot water and then used for gargling. So when certain oils like Ayurveda style and all that, when we use these oils, so the entire buccal cavity remains healthy. The teeth remain healthy. Person when people start doing it right from their 20s and 30s, Gandushanam, later on in their lives, when they enter into their 50s, 60s, and 70s, even then their teeth remain healthy. There is no tooth will fall. When a person practices these procedures, simple procedures in Ayurveda, and then take regular oil massage, this is known as Abhyangam. And regular oil massage for 6 days a week, a person has to take oil massage. So when regular oil massage, it could be with plain sesame oil, it could be with coconut oil, it could be with mustard oil. So again, for each person individually, each oil may be suitable. There are different body constitutions based on the doshas. We classify people, all human beings, into 3: Vata Prakriti men, Pitta Prakriti people, and Kapha Prakriti people. And based on each one's Prakriti, people will have to use different oils for massage. So when oil massage is done regularly, the bones and joints will not start aging slowly. The entire nervous system will start aging slowly. The skin will start aging slowly. And all body systems, they will age slowly when, when we do proper abhyangam right from our 20s and 30s. So Acharya says that abhyangam achareta nityam. Abhyangam has to be practiced every day. So just like how we do nitya karma anushtanam, every regular sandhya vandanam, sandhyadhanam if brahmacharis, aupasanam if a person is a grihastha, and then regular stotra parayanam, and also we do all of these on a daily basis. So in the same way, Ayurvedic abhyangam has to be done on a daily basis. So why should abhyangam be done? Sa jarashrama vataha, says Acharya. Jara means age. So here, the age-related changes in different systems. So that is Jara. Shrama is tiredness. And Vata is, so Jara, Shrama, Vata, anything that helps to reduce Jara, Shrama and Vata is Jara, Shrama, Vata. And then do yoga or exercises regularly. And then from the coming day, looking at yourself, taking care of your health. So this is what we have. And apart from this, what does the Ayurvedic fraternity have to offer for healthcare in the 21st century? So there are, many conditions like, osteoarthritis and rheumatoid arthritis. So in such conditions, we have excellent treatments in Ayurveda, simple treatments, simple and effective treatments. And then for, people suffering from, GIT diseases like GERD, stomach ulcers, duodenal ulcers, and then ulcerative colitis, Crohn's disease. So we have excellent treatments in Ayurveda. And then, for diseases like Parkinson's disease, stroke, migraine, sinusitis, and then respiratory diseases like asthma, COPD. We have, a wide range of procedures like abhyangam, pedichil, different forms of sveda. The word abhyangam means oil massage. And pedichil is, the word dhara means, from a specific height. When we irrigate any part of the body with a specific oil or any other fluid, that is known as dhara. Now we've got procedures like shirodhara, kashaya dhara, takra dhara, and all that. And then applying heat in many different forms is known as swedanam. So we've got procedures like patrapinda swedanam, churnapinda swedanam, and all that. So in these, the word patra means herbal leaves. So herbal leaves will be cut into small pieces and then made into a cloth bag that you see here in the middle. So this is known as patrapindam. And applying heat using patrapindam is patrapinda swedanam. In many bone and joint diseases with pain, we give patrapinda swedanam. There are certain medicated powders or churnams which are made into a bolus like this, and then through that we apply heat. That is known as churnapinda swedanam. And we've got many different forms of swedanams like this. So, this is just an overview of what Ayurveda is. So now with this, the time is over for me. It is 8:48 now. So with this, I would like to conclude. So is there any questions?
Thank you so much. Okay, someone has a question. Please go ahead.
Namaskaram. This is Anandi. I have a basic question. You said some combination of Vata or Pitta is needed for proper menstruation, and the same also contributes to having constipation. How can one have normal menstruation cycle but also be constipated?
I mean, a normal menstrual, so the Apanavata within the reproductive tract is different, and the Apanavata within the intestine, the intestinal tract is different.
I see. Got it.
Yeah. So both of these are different.
Okay. Namaste. This is very informative. Namaskaram.
Okay. Any other questions?
If nobody has questions, I would really like to thank Dr. Gokulakrishna for this fantastic introduction to Ayurveda. His passion is very catchy. It was very, very detailed, and there is so much information presented in a simple to understand format. This session is recorded, so it will be uploaded to YouTube for us to go back, and because there was really a lot of information. so we could go back and learn. And especially in these days and times where we really have to modify our lifestyle to become healthy, all the suggestions from Ayurveda about basic lifestyle changes would be very valuable for us. And we could go back and refer. And thank you so much, Dr. Gopalakrishnan. It was, your enthusiasm is very catchy. And I'm sure like everybody was everybody would benefit so much from such lectures. Hope we can have you back again soon. So if people have more questions, they can ask you, and you could probably take a topic of just one topic and expand on it. And also we know that your other passion is Sri Appaya Dikshita. So probably in future, sometimes we would also love to hear about Appaya Dikshita and your extraordinary work on him. Thank you so much, sir. Does anyone else want to say anything, or Ram Ram?
Thank you for the great session. I would love to hear about